Okay, let's start about the hormone biosynthesis where we have left. There are 6 center of asymmetry on the basic ring structure. There are 64 possible isomer. Okay, then the convention of naming steroid use the number of carbon atoms to design the basic name. Pregnant, androsten, estrone. The basic name is preceded by the number to indicate the position of double bond. So these are the things. This is the testosterone, estrone. This is the progesterone. Then steroidogenesis, the production of all three major group of 6 steroid is achieved through a common pathway which begins with cholesterol molecule. Okay, in this section we'll discuss biology in the process of cholesterol synthesis and its 6 steroid hormones. The lipoprotein cholesterol is the building block of steroidogenesis. Cholesterol is the building block of steroidogenesis. All steroid producing organs except the placenta can synthesize cholesterol from acetate. All steroid producing organ except the placenta. All steroid producing organ except the placenta. Only if you except the placenta, every organs, all steroid producing organs can synthesize the cholesterol, synthesize cholesterol from acetate. The progesterone, androgen, estrogen therefore can be synthesized in situ in the various ovarian tissue compartment from the two carbon acetate molecules. So usually from the acetate they synthesize the cholesterol, all the steroid producing organs except the placenta. Okay, so by cholesterol as the common steroid precursors. However, in situ synthesis cannot meet the demand. How much synthesis is done that cannot meet the demand. So therefore, the major resource is blood cholesterol into the ovarian cells and can be inserted into the biosynthetic pathway and stored in a stay-free form to later use. So the demand could not be met. So we should take some uptake by the cholesterol is food like blood recent, so that will saturate the blood's cholesterol that enter the ovarian cells that can be inserted into biosynthetic pathway or stored in instead form for later. The cellular entry of cholesterol is mediated by cell membrane receptor for low density, the bloodstream carrier for cholesterol. Lipoprotein are large molecules that facilitate the transfer of non-polar fats in the polar solvents. Then chylomicron, large cholesterol triglyceride, all you know, PLDL, LDL, all these things. Okay. Then high density lipoprotein, the smallest, most dense, is the smallest and most dense lipoprotein, highest protein phospholipid. All this thing. Okay. Then steroid biosynthesis pathway. The overall steroid biosynthesis pathway is based primarily on the pioneer that this pathway follows a fundamental pattern displayed by all steroid producing organ. It should not no surprise that the normal human ovary produces all three classical 6 estrogen, progesterone, and androgen. The importance of ovarian androgen is appreciated not only as a obligate precursor of to estrogen, but also it is clinically important secretive product. The ovary differ from testis is in a fundamental complement of the critical enzyme in its distribution of secretive product. The ovary is distinguished the adrenal gland in the deficiency of 21 hydroxylase enzyme and 11 beta hydroxylase reactions. So ovary is different from the adrenal gland by the deficiency of the 21 hydroxylase is absent in the ovary, 11 beta hydroxylase also absent in the ovary, and the sometimes the evidence of ovarian steroidogenesis is not only obligate precursor to estrogen but also clinically important critical enzyme. Okay, glucocorticoid, mineralocorticoid therefore not produced in the, so because of the deficiency of the 21 hydroxylase, 11 beta hydroxylase, the glucocorticoid and the mineralocorticoids are not produced in the normal ovarian tissue. Okay, then we understood things better. So during steroidogenesis, the number of carbon in the cholesterol near the steroid molecules can be reduced but never increase. It always decrease but never increase. The following reaction take place of side chains, conversion of hydroxy group to into ketone, ketone into hydroxy group, dehydrogenase reactions, despolase reaction, addition of hydroxy group, hydroxylase reaction, creation of double bond triple hydrogen, addition of hydrogen to reduce double bond saturation. Okay, this is all the enzyme 11 beta and all this. Then P450 enzyme, mitochondria, cellular locations, this cholesterol cleavage, then all this enzyme, you know. These are the endobasilic mitochondria. There is two enzyme. There is cholesterol side chain linkage 11 hydroxylase, 18 hydroxylase, 11 90 hydroxylase. Rest all are in the endoplasmic reticulum. These are all these things. The star one. Then we will talk about estrogen. Or how the estrogen synthesis is done. Androgen are the precursor of estrogen. First thing you know, androgen is the precursor. So from the androgen you made the estrogen. 17 beta hydroxysteroid dehydrogenase activities convert the androstenedione. This convert androstenedione to, with the help of 17 beta hydroxysteroid dehydrogenase, the 17 beta androstenedione to convert testosterone, which is not a major secreted product of the normal ovary. It is rapidly demethylated at the C19 position aromatase to estradiol. So from the androstenedione, it is from testosterone. Testosterone is formed by aromatase G rapidly demethylation at the C19 position. That cause aromatases to the estradiol. The major estrogen secreted by the hormone is the estradiol. Okay, this was the well characterized two cell system describing the length. The estradiol also arises to a major degree from the androstenedione via testosterone, and estrone itself secrete insignificant elements. Estriol is the peripheral metabolite of estrone. So estriol is the peripheral estrone, and estradiol is metabolite into estriol, not a secreted product. The formation of estriol is a typical general metabolic detoxification. The converse of biological active metal is the less active form. So estradiol major estrogen secret the ovary. Estradiol, okay. Then this is the two-cell 2-gonadotropin therapy. Thicker cells. This is the LH receptor, cyclic AMP, cholesterol from androstenedione and testosterone. This is transfer into granulosa cells. TZ faces receptor act on the granulosa cells. Androstenedione and testosterone is aromatase estrone and estradiol. Okay, estrone. The conversion of steroid in peripheral tissue is not always for a form of inactivations. The conversion of steroid in peripheral is not always a form of inactivation. In the female, the adrenal remain the major source of circulating androgens, particularly the androstenediones. In the male, almost all circulating estrogen are derived from the peripheral conversion of the androgens. The precursor of androgen consists principally the androstenedione, dihydroepiandrostenedione, dihydroepiandrosterone sulfate. Okay. The peripheral conversion of steroid to progesterone is not seen in the non-pregnant female. Rather, the progesterone production rate is combination secretion from the adrenal and the ovary, including the small contribution from the adrenal. The blood production rate of progesterone in the pre-ovulatory phase is very less, that is less than 1 mg per day. During the luteal phase, the production rate is 20 to 30 mg per day. In the pre-ovulatory phase in adult female, in all pre-pubertal female, in the normal male, blood level progesterone at a lower limit, that is less than 1 nanogram. After ovulation, that is during the luteal phase, the progesterone range is 3 to 15 nanogram per ml. In congenital adrenal hyperplasia, the progesterone level can be high as 50 times above normal. Pregnadiol and triol are the metabolites of progesterone that are excreted in the urine. Okay. The major androgen product of the ovary is DH, dihydroepiandrostenedione, which secrete mainly the stromal tissue derived from the thicker cells, which excessive accumulation of stromal tissue in the presence of androgen producing tumor. The testosterone becomes a significant secreted product. Occasionally, non-functional tumors can induce stromal proliferations, increase the androgen production. The normal accumulation of the stromal tissue at mid-cycle resulting in a rise in the circulating level of androgen and testosterone in the time of ovulations. The adrenal cortex also produces three groups of steroid hormones like glucomineral and sextroid. The adrenal sextroid is present as an intermediate byproduct in the synthesis of glucocorticoid. The only with neoplastic cells in association with enzyme deficiency. Under normal circumstances, adrenal gland production of sextroid is less significant than gonadal production. About one half of the androgen is secreted by the ovary, while the other half of the diet is secreted almost equally in the ovary and the peripheral tissue. The production rate of testosterone is normal female is 0.2 to 0.3 mg per day. Peripheral conversion is testosterone 25% of the ovary, 25% adrenal. The reduction in the saturation in testosterone is very good. The 5-alpha derivative not androgenic. This is not clinically important pathway. However, the 5-alpha derivative is a very active pathway, is extremely potent. Indeed, the 5-beta dihydrotestosterone is a 5-alpha derivative, the principal androgenic hormone, and variety of target tissue is formed within the target tissue itself. In men, the majority of DST derived from the testosterone that enter the target cell is converted into mains 5-alpha reductase. In women, because of the production rate is greater than the testosterone, androstenedione is greater than the testosterone. The DST is primarily derived from the androstenedione directly from the DHEA. Thus, in women, the screen production of DST is not influenced by androstenedione. The DST dihydrotestosterone is by definition intracrine hormones formed and active within the target tissue. The 5-alpha reductase enzyme exists in type 1 and type 2, which are encoded by the separate gene. With type 1 enzyme is found in the skin. Type 2 is predominantly in the reproductive tissue. DST is largely metabolized intracellularly. The blood DST is only about 1/10 of level of the circulating testosterone. In tissue sensitive DST, like hair follicle. Only DST enter the nucleus to provide the androgen message. DST also can perform androgenic action within the cells that don't possess the ability to convert testosterone to DST. DST is further reduced by 3 alpha ketoreductase to androstenediol, which is relatively inactive. The metabolite androstenediol, 3 alpha androstenediol glucuronide is the major metabolite of DST, can be measured in the plasma, indicate the amount of target tissue conversions to testosterone to DST. Not all androgen sensitive tissue require prior conversion of testosterone to test diet testosterone. In the process of masculine differentiation, the development of the Wolffian dog structures epididymis bars difference the seminal vesicle is dependent on the testosterone as the intestinal mediator, whereas development of the urosogenital sinus, urogenital tubercle into the male external genitalia, urethra, prostate requires the conversion to testosterone to test DST. So from this point, we should know the development of the Wolffian duct, only the testosterone is required. Develop the testosterone as an intestinal material, that Wolffian duct like epididymis, seed structure, seminal vesicle, epididymis, the vast difference, only testosterone required. For the DST is required for the development of the urogenital sinus, urogenital tubercle to the development of the external genitalia, urethra development, prostate requires the conversion of DST to testosterone to DST. Muscle development is under the direct control of the testosterone. The testosterone also aromatizes into significant extent in the brain, liver, breast, in some circles in the transferred by estrogen. Okay, the blood transfer of the steroid. While circulating in the blood, majority of the principal sex steroid, estradiol testosterone, is bound to a protein carrier known as sex hormone binding globulin. It is produced mainly in the liver. Additionally, this 30% loosely bound to the albumin, very small percent to the corticosteroid binding globulin, leaving about 1% unbound and free. So, hyperthyroidism and pregnancy, estrogen administration all increase the SHBG. So, thyroid hormones increase thyroid, hyperthyroidism, pregnancy, estrogen administration increase SHBG. Whereas the corticoid hormones, androgen, progesterone growth hormones, insulin growth factor decrease the SSBG. So what are the factor increase? One is pregnancy, one is thyroid, hyperthyroid, and estrogen administration. Other things that decrease. The, the circulating level by SSBG is inversely related to the body weight. Thus, when the weight will be significantly, the weight gain, that will significantly decrease the sex hormone binding globulin, so that the more free from will available, that will is more active form, so that cause hyperandrogenemia. Additionally, the circulating sex hormone SSBG also reduced in the patient who those having insulin resistance and hyperinsulinemia. This, in fact, may be the major mechanism that mediate the impact of increased body weight and SSBG. The relations between the level of insulin and SSBG is so strong that SSBG concentration are marker for hyperinsulinemia and insulin resistance. So, a low level of SSBG is a predictor of the development of type 2 diabetes mellitus. The distribution of the body fat also has a strong influence on the SSBG level. The android and the central fat is located in the abdominal basal mesenteric location. This fat distribution also hyperinsulinemia, hyperandrogenism, decreased level of SSBG. The common mechanism for the change is probably hyperinsulinemia, while SSBG is a homodimeric glycoprotein composed of two monomers. This contains a single binding site for androgen and estrogen. Its encoding genes has been localized for the certain chromosome 17. The genetic study have revealed that the SSBG also encode the androgen binding protein present in the seminiferous tubule. Synthesis was approached. The dimerizations are believed to be related from the single thread binding sites. The specific genetic abnormality decrease or abnormal SSBG have not been reported. SSBG expression has not been identified in the other tissue like brain, placenta, endometrium. All the biological not recognized. Previously mentioned SSBG decreased by androgens, hence the binding capacity in male lower than the movement. The binding globulin level of immunity increase, androgen production also depressed. The total testing can be in the normal range of who is irresolute, but because the binding globulin is depressed by the androgen effect, the percent free and active testosterone is elevated. Totally free and active. Transcortin also called cortisol binding globulin, that is a placement like the binding cortisol progesterone. Biological effect of the other major sex steroid as related to the unbound portion known as free hormone. In other words, active hormone is unbound and free, whereas bound hormone is relatively inactive. This concept is not without controversy. The hormone protein complex, the importance of local sex hormone production. Well, the transfer of the sex steroid is a key factor mediating the biological effect. Women testosterone function as a paracrine and those women in testosterone as a paracrine intracrine hormone. In men, abundant secretion testosterone creates circulating levels that are sufficient to allow testosterone to function as a classical hormone. In women, the same description estradiol function as a classical circulating hormone until menopause. both estradiol and estrogen activity due to local target tissue synthesis using precursor derived from the circulations. Clinician intervention after menopause, therefore directed to local hormone production, the use of aromatase to breast cancers. Excessive excretions, testosterone like sulfide, glucuronide conjugations, pregnenolone, mechanism actions of steroid hormones. The steroid hormone diffuses across the cell membrane. The steroid hormone binding with the receptor protein interaction hormone receptor complex with the nuclear DNA synthesis messenger RNA transport of messenger to ribosome. And the protein synthesis in the cytosol result in specific cellular activity. The circulation, cytoplasm, H nucleus, DNA interactions, transcription, mRNA, ribosome, and protein translations. Hormone response element. Okay, this is all this. Estrogen receptor. There is two estrogen receptor. It is estrogen alpha and beta. Hormone by alpha binding domain, secretion, all these things are the most important. Okay. Well, the steroid hormone receptor antagonist, well, agonist is a substance that stimulates the response when bound to the receptor. Antagonist inhibit the action of agonist. Antagonist activities carried out blockage of the receptor message, non-transfer the message. Most compound using this patient bind to the hormone nuclear receptor have mixed agonist and antagonist respectively in the tissue hormonal value. Antagonists include tamoxifen, mifepristone, androgen receptor antagonist. Then short-acting antagonist as a estriol. It's a mixed combination agonist and antagonist during the time. Short-term estrogen response is because estriol bind to the nuclear receptor. Long-term don't occur because of the binding short-lived. Estriol complete with estriol receptor. A constant presence of a weak hormone estriol can be maintained. The long-term occupation is possible. Potential when produced. Long-acting clomipene, tamoxifen, mixed estrogen agonist and antagonist. The endometrium is very sensitive to agonist response, whereas the breast is more sensitive to antagonist behavior. The antagonist is nuclear binding. The physiological antagonist. Strictly speaking, progesterone is not an estrogenic antagonist. It modifies estrogen action because causing depletion of the estrogen receptor. It modified the estrogen actions. What are the estrogen actions by causing depletion of the estrogen receptor? There is also evidence that progesterone can inhibit transcription activation of the estrogen receptor. In addition, progesterone induces enzymatic activity that convert the potent estradiol to important estrogen sulfate, which is then secreted from the cells. The androgen block the action of estrogen also by the target tissue estrogen receptor. Anti-estrogen, currently there are two groups of anti-estrogens, pure estrogen and estrogen, compound with both agonist and antagonist. Pure and mixed agonist and antagonist include both triphenyl-ethylene derivative, non-steroidal estrogen relative, clomiphen, tamoxifen. Mixed, the non-steroidal sulfur containing is benzothiouraloxifene. One is your mixed agonist and antagonist, that is non-steroidal estrogen relative, like non-steroidal, it's not a steroid, clomiphen, tamoxifen. Non-steroidal with sulfur containing is benzothiouraloxifene. The pure estrogen and estrogen is bulky side chains, that is only little imagination pictures to support idealized and estrogen following properties. Pure antagonist, proliferate breast cancer, resistance to recur, long exposure, high affinity for the estrogen receptor, no intervention, the beneficial action of estrogen, no toxic anti-estrogen tamoxifen. Very similar to the clomiphen citrate. Both being non-steroidal compounds, toxic related to the diethyl tamoxifen is binding to the estrogen receptor, completely inhibit the estrogen binding. The estrogen binding affinity is greater than the tamoxifen. Thus, tamoxifen must be present in a concentration more higher than the estrogen to maintain high inhibition of breast cancer cells. In vitro, the study demonstrated the action is not cytocidal rather than cytostatic. Thus, it is must be long term. The tamoxifen estrogen receptor complex bind to DNA, but whether an agonist estrogen receptor message or antagonist anti-estrogenic message predominate is determined by the what promoter element co-activator is present in the specific cell types. The mechanism is cytostatic. Why does the treatment period of 5 years provide for against recurrent disease for at least 10 years? It has been said that the exposure to tamoxifen desensitizes the cells to the apoptotic effect of the woman's own estrogen level. Apoptotic effect of the woman's own estrogen level. Therefore, there have been many clinical trials argumented into breast cancer with tamoxifen is still ongoing. Or the impact of tamoxifen to breast cancer can be summarized as follows: clinical survival rate prolonged. increase survival, disease-free survival follow, increase survival 5 year and 10 years follow-up after 26%. And the serum protein receptor agonist tamoxifen mechanism actions both activate transcription F1 F12